Continuing with the anticipatory guidance, our fourth thing on the list is injury prevention and trauma. Excuse me. And one of the most common questions I get is, what do I do if my kid's tooth gets knocked out? And the answer is it depends. Baby teeth or primary teeth, which is the teeth kids have up to about the age of 6 when they start getting their permanent teeth in the front and some permanent molars in the back. But primary teeth or baby teeth, we don't put back in. We do want to see the child to make sure that all the tooth did come out, there's not some left, or if they had an accident and their lip is cut, that it's not actually embedded in their lip. There's a lot of things we want to look at. But the problem with primary teeth and putting them back in is that the tip of the root is where the permanent tooth forms. And so if we take that and start pushing it back up there, we're basically messing around with the tooth bud that's forming for the permanent tooth. And definitely, if we're going to lose a tooth at 6 years of age, and then we're going to be replaced with a tooth that's going to last us the rest of our life, we don't think it's worth the risk to try to put a baby tooth back in. Permanent teeth is different. And starting about 6, we start getting permanent teeth, and most kids at 7 or 8 have their permanent maxillary or upper incisors. And these are the ones that usually get hit with baseballs, elbows, golf clubs. I could go on and on. These we do want to put back. Obviously, these are permanent teeth. And the safest or the most ideal thing to do is, if your child has a tooth knocked out, is to gently rinse it off. And if you are comfortable with which way it goes, is put it back in where it came from and bring them to the office. Put something on them to bite down and bring them back to the office. That's going to provide nutrients to the cells that are on the root to help keep that thing alive. The other thing you can do is, if they can't do that, but you can put it inside their cheek if they're old enough and you know they're not going to swallow it. And then the safe one, and most people know this, is you can put it in some milk and bring it into the office. And then the bottom line, if you know you're at the ball fields and no one has milk, put it in some water and bring it. The most important thing is getting to the dentist as quick as you can. If we can get it in less than an hour, meaning it's out of the mouth less than an hour, the chances are a lot better that we can get that tooth in. It'll probably need a root canal, but we can get it in, and that tooth will stay and work and function as a normal tooth for the rest of your life. But the key is time. This isn't something we hold in a glass of milk overnight and then come in, because at that point the game's over. So baby teeth, we don't reimplant. Permanent teeth, we do. And the key is to get here as soon as possible.